Hello everyone, my name is Shahnaz and I welcome you all to my channel Nurses, the Heart of Healthcare. My special greetings to all the student nurses and the nurses working in the various healthcare settings around the globe. As we all know that nursing is a very noble profession. Nursing is a very challenging, highly responsible and a caring profession. And as a professional nurse, I take this opportunity to salute the exceptional and the selfless work of all the nurses around the globe. Nurses, you are the heart of healthcare. Nurses, you are the backbone of the healthcare system. And nurses, you are the foundation of any hospital. So I salute all the nurses around the globe for their exceptional, selfless, and continuous work with lots of dedication, and it's really appreciating and a rewarding work. And believe me, we are in a very noble profession and doing a very noble job. So I salute you all. And before moving ahead, I really appreciate if you all subscribe my channel and like and share my videos. Like everybody else, I just wish and pray that my this little efforts reaches the maximum number of students and the working staff, so that they find it very helpful in their studies and career ahead. So I just wish and pray that I get maximum number of subscribers, and I salute all you nurses. Okay, so now, as a professional nurse, I just want to ask few questions to you before going to the main topic of this video. As a professional nurse, do you want to provide exceptional care to your patient? Do you want to excel in your nursing career? Do you want to establish a therapeutic relationship with your patient and patient's family? Do you want to play a leading role in the healthcare setting where you're working? Do you want to provide a distinguished and innovative contribution to the healthcare system? Any caring and ambitious nurse would obviously say yes. And if your answer is yes, and if you want to accomplish this goal, and if you want to provide, if you want your job to be done in an effective and efficient manner, and if you want to treat your patients well and make sure that they are safe, then you have to operate based on the 6Cs of nursing. So the topic of this video is 6Cs of nursing. In this video, we will know regarding what the definition of the 6Cs of nursing, okay, and who launched it, why it was launched, the aim and the purpose of the 6Cs of nursing, the importance of the 6Cs of nursing, and then we'll discuss each component in detail. Okay, so please be with me. And if you are already well into your nursing career, then you will be very familiar with the 6Cs of nursing, and it should be something that comes naturally to you. But if you are new to this concept, then I really request you to be with me till the end of this video. Now, coming to the first question, what are 6Cs of nursing? 6Cs of nursing are nothing but the 6 fundamental values that were designed to support the professional and the healthcare system to deliver excellent care. Okay, these are nothing but a set of core values and expectations of the registered nurses in the UK. Okay, so the 6Cs of nursing are the foundation upon which your practice as a nurse will be built. Okay, the 6Cs are, as you can see there, care, compassion, competence, communication, courage, and commitment. I repeat, the 6Cs of nursing are care, compassion, competence, communication, courage, and commitment. And the 6Cs are considered fundamental to the nursing care, and these are the essential building blocks for establishing a therapeutic relationship with your patient and the patient's family. Okay, so these are very important, and we must, learn about this, not just memorizing the 6Cs. We need to understand the depth of it and practice this in our profession so that we enjoy our work and get patient satisfaction. Now we know the 6Cs. Now let's see who launched this 6Cs in the nursing profession. So it is this beautiful lady. Her name is Professor Jane Cummings. Okay, so she's the one who launched the 6Cs of nursing. Okay, she in 2011 she was appointed to the role of chief nurse for the north of England, and the next year in 2012 she began the full-time position of CNO, that is Chief Nursing Officer for England, and was the professional lead for all the nurses and the midwives in England, okay, except for the public health. Okay, so actually she was previously a nurse specializing in emergency care before progressing into the managerial general management. Then she has held a wide variety of clinical and managerial roles, including the director of commissioning, director of nursing, and the deputy chief executive. Okay, so this beautiful lady has done a very great job and she has contributed a lot to our field. Okay, so in 2014 she became the national lead for emergency care, and in 2018 she retired from the CNO role, and she was awarded CBE in the New Year honors. Okay, so CBE, as you can see, she is receiving CBE award. Let me tell you what is CBE. CBE stands for Commander of the Order of the British Empire. Okay, it is the highest ranking order of the British Empire award, okay, which is given for obviously some great work. Okay, so she received this award. Fine, so she is the one who launched 6Cs of nursing, okay, in 2012. Now next, coming to what is the purpose of the 6Cs. Okay, see, the purpose of the 6Cs is to ensure that the patients are looked after with care and compassion every day, and to provide exceptional care to your patients and excel in your nursing career. Okay, so the aim of the 6Cs was that it should be universally adopted and embraced by everyone involved in commissioning and delivering care. Okay, the 6Cs aims to empower all the healthcare staff to contribute to making improvements in care. The purpose of the 6Cs is to ensure that the patients are looked after with care and compassion by competent workers and who communicate well and dare to make changes that improve care and commit to delivering this all day and every day. Okay, so this was the purpose of 6Cs being introduced into the nursing profession. Next, coming to the importance of 6Cs of nursing. See, the importance of 6Cs of nursing is to establish and maintain a high level of care. The NHS, that is National Health Service Commissioning Board, introduced a strategy called Compassion in Practice, and this strategy is based on the concept of 6Cs of nursing profession. This 6Cs of nursing underpin the level of care, support and attention a professional nurse should give to the patient. Okay, the concept of 6Cs of nursing gives nurses an easy and consistent way to understand their values as professionals and care staff and hold themselves to account for the care and services. Okay, so all the points of this 6Cs concept carry equal importance, not like one point is more important than the other one. Okay, so this naturally focuses on giving care to the patient by emotionally understanding their condition. The concept of 6Cs is very important for all the nurses to understand, to embrace, and to get it naturally in their behavior. Okay, so because it ensures that every patient is treated equally with high quality care services. The first C of the 6Cs of nursing is care. What do you mean by care? Care means just looking after somebody's health or needs. Okay, care is to devote thoughts to something and to consider that it is important enough to be worthy of concern. Okay, so A good nurse always strengthens her patient with proper nursing care. A good nurse is always caring. Nursing itself is a caring profession. And caring means what? What do you mean by caring? Caring means that the dynamic essence of caring, of nursing, is due to caring, and nursing is a caring profession. Caring means it's a feeling or showing concern or kindness to others. Okay, so patient care is not just about the medical aspect of nursing. Patients may experience stress about their condition. Okay, obviously patients may experience stressed about their condition, about their injuries, about the procedures, about the surgery that they need to undergo, and the recovery process. So caring is very important in the nursing profession. It is important for the nurses to treat the patient's physical ailments as well as his or her emotional needs. Okay, so nurses who truly care for their patient while providing medical assistance create a rewarding experience for everyone. There can be no curing without caring, and it requires knowledge and skills to provide adequate care. Caring is essential in the nursing profession because it helps with the healing process. Caring can range from a small talk about the hobbies or the pets to listening to someone's fears or worries so they feel less alone and more confident that their needs will be met if something goes wrong. How you can show the caring in the nursing profession is by ensuring high quality care just by putting a smiling face, okay, making an eye contact with the patient and greet your patient by their name, sit in a chair next to the patient when conversing, listen attentively without interrupting. A nurse should be a very good listener, okay, and carry out the request, ask the patients what they need and clarify their doubts, answer their questions and keep them safe and prevent harm, and try to provide quality and compassionate care. Okay, so these are the ways in which you can show that nurses are caring, and you can build trust, patients trust. The next component is compassion. Compassion means what? Compassion means in informal words, compassion means to suffer together. Compassion is pity for somebody who's suffering. Okay, a strong or a deep feeling of sympathy or sadness for the suffering or the bad luck of the others, and a wish to help them. Okay, so many people talk about compassion but very few people practice it. Okay, compassion means a sympathetic consciousness of others' distress together with the desire to alleviate it. The actual meaning of compassion is to recognize the suffering of the others and then take action to help. Okay, compassion is how care is given through relationships based on empathy, respect and dignity. Nurses often work in a very stressful conditions, as we all know, but in doing so they must remain compassionate even if a patient is particularly difficult and it's coming to the end of their shift. They should show compassion as it is central to how patients view their care. Compassion is the centerpiece of the nursing profession. Compassionate care makes patients more comfortable when they are in pain, feeling ill, or suffering from mental or emotional stress. By demonstrating compassion, we provide our patients with the support and confidence they need to prepare for a lengthy recovery, to face a frightening surgical procedure, and to fight a devastating disease. Okay, so practice compassion, and how we can practice it? By practicing good manners, by being empathetic, and understand what your patients are going through, getting to know your patients better to understand their needs, giving patients someone to talk to, which is especially important for the patient who don't have a family or friends to lean on, and being an active listener when the patients discuss their health issues or complaints, and also solidify your bond with the patient. Okay, so these are the ways you can show compassionate care to your patients so that you gain their confidence and make your patients more comfortable when they are in pain. Being a compassionate nurse not only benefits the patient but also benefits the nurse. Nurses who are more concerned about their patients' well-being and pain and fear, they feel typically and enjoy their jobs more and feel connected to their careers. Okay, so providing compassionate nursing care can lead to a higher satisfaction in patients and can also offer tremendous self gratification. So listen to the patient carefully without judging them, apologize when you make a mistake, learn from your mistake and from the patient's feedback, and provide emotional support during the critical times of your patient's treatment and recovery, and use a positive voice and body language, and knock on the door before entering the patient's room. Okay, this shows dignity and respect and their privacy is respected. Okay, and take time to explain the test and the procedures and answer your patient questions. Okay, so that they feel that they are heard and they feel important. Okay, and help to relieve your patient's concern, okay, when they are in pain. Fine, so these are the ways providing compassionate care is very, very important. Coming to the next component of 6Cs of nursing, that is competence. Competence is nothing but capability. Competence is the ability to do something well or effectively. Possession of the required skill, knowledge, qualification or capacity is known as the competence. Okay, so when you are capable of performing a task or job effectively, you are called a competent. Okay, competence means what we say, nursing competence is very important. Okay, nursing competency is a natural intelligent skill that integrates various factors and problems in complex ways unique to every situation. Nursing requires constant updating of knowledge and skills in order to keep up to date with the latest practices. Patients have a wide range of needs and treatment requirements, and they also come from variety of walks of life. So it's very important that the nurses keep themselves updated, and because we all are in learning process, so nursing you have to continue to learn. Okay, the three important components of competency include the ability to achieve patient-centered care, the ability to improve nursing quality, the ability to understand the people better. Okay, so competence means having clinical skill and the knowledge to deliver effective care based on the evidence and research. Okay, so a competent nurse always continues to learn. Okay, so she never stops, she keeps learning about the new technology, okay, and how to use it and how to improve the patient care. The next component is communication. Communication. In general, communication means is nothing but exchanging of information by speaking, writing, or using some other medium. Okay, communication is very important. Communication is central to successful caring relationships and to effective team working. Communication is essential to a nurse's success. Communication has a major impact on the outcome of the treatment procedure. Excellent communication is vitally important for all the medical professionals. Okay, so communication, we say it is now among it's a big goal now. Okay, because communication between nurse to a doctor, nurse to patient, nurse to family, and researchers have found that most patient errors are usually based on a lack of communication. So we need to communicate clearly and properly. Increased communication between nurses and patients decreases the errors and makes a difference in the patient outcomes. So a nurse should have very good communication skills and she should be a good listener. Okay, the problem with the communication, the biggest problem of the communication is we listen to reply, we don't listen to understand, and nurse should listen to understand, not just to reply. And as we know that there are two types of communication, one is verbal communication and the other one is non-verbal communication. Verbal communication is which involves the spoken words by the patient, by the healthcare staff and by the patient relatives, and non-verbal communication is where the speech is conveyed with the help of body language, with the accent, with the gaze, with the speech tone, posture, physical appearance, gestures, movements, etc. Okay, so please communicate well and clearly. Then the next component of the 6Cs of nursing is courage. Courage is an ethical practice in nursing, is as an ethical practice requires moral courage to speak what is right. Okay, so courage enables the nurses to make the right choices throughout their career and do what's best for their patients. Nurses should have the courage to make judgment calls and to convey their opinion if they think that the other treatment options can be done more effectively to provide quality care. Nurses must be courageous, doing what they believe is right and beneficial for the patient in all regards. They must also have the courage to stand by the values and standards of the profession. Nurses must have the courage to do what they think is right and be brave enough to confront fear of difficulties. It's a strength, it's a personal strength, okay, to easily adapt to each new environment and overcome any challenge that is thrown at them. The last component of the 6Cs of nursing is commitment. Professional commitment is the sincerity, the passion for staying in a profession, and a sense of responsibility towards the hurdles and challenges in a profession. Nursing professionals have a commitment to their patients, and this helps them take the necessary steps to improving the quality of care they receive and ensuring they have a positive care experience. Commitment to learn new skills and knowledge, share knowledge, coordinate, take action against the wrong practices, and work efficiently. Looking after your own health and maintaining a code of conduct in our social lives in order to be the role model. Okay, so these are the highlights of commitment in a nursing career. So we need to put our social life after your professional life, especially in emergencies, and maintain your health so that you show yourself as an example to your patients, and always try to learn new skills and knowledge from your co-workers, and try hard to give quality care, high standard care to your patients. Care your patients and make sure you treat every patient equally, and willingness to show up for your shift ready and on time every time is shows that you are a competent nurse. You are committed to your job. So nurses, no matter how busy your shift is or how challenging a new environment, stick to the 6Cs to ensure you continue to do what you do best. So nurses, please operate on these 6 core values. Adopt, embrace and practice these 6 values so that you make sure that your job is done effectively and efficiently, and your patients are taken care well and they stay safe, and you receive a higher patient satisfaction and your professional satisfaction. At last, I remind you all again to subscribe my channel, like and share my videos. Thank you so much for watching. Stay connected with my channel, Nurses, the Heart of Healthcare. Thank you so much for watching.